Today, we got a reality check. After a decade of accelerated work on the opioid crisis to get more people into treatment, there is still a huge gap. 2/3 of people who want or need help struggle to get it in Colorado. Anusha Roy joins us, and Anusha, we've talked about treatment for so many years on this show, and today we get this progress report.
Yeah, I mean, along with so many people, I've just been reading headline after headline about fentanyl and Colorado's new laws, and then I found myself looking for some context around all of this. So I talked to Dr. Valuck, a drug addiction expert, and the very first thing that he brought up was treatment. Dr. Valuck is with the Consortium on Substance Use Prevention and said that Colorado has a 60% treatment gap. We are talking 6 out of 10 cannot or are struggling to get into treatment because they don't have insurance. There aren't enough providers. There's still stigma. And here's the thing, that is actually considered better than so much of the rest of the country.
Well, if the country was at 84% 10 years ago, 81 to 84% treatment gap, and we've reduced down to about 60, and most of the country is down to about 75% treatment gap, well, then on the one hand, we're doing better than most states in addressing that. But everybody still has a long way to go. If we're one of the best, and we still have 6 out of 10 people struggle to get treatment, it's kind of like, you know, we're the best of still struggling to do a good job with this.
So we're talking about a 20%, roughly 20% reduction. And what did work was Medicaid covering treatment, growing the workforce, expanding treatment programs, especially in rural areas where that gap is a lot more pronounced. That work, though, that is taking years as the crisis is getting worse. Of course, we've been hearing a lot about fentanyl, and yes, it is a huge culprit in this crisis, but it also isn't the only one. So are lack of resources or helping a person before developing addiction and after.
Demand will still be where it is. If people can't get treatment, well, then their only choice is to remain taking what they're taking and getting it from the same place they're getting it, which is on the street. And the economy stays there. And someone will meet that. Someone will meet that demand.
So, of course, the rules are changing here. Colorado's new laws are putting more resources towards harm reduction and treatment, but they're also stiffening felony charges for dealing fentanyl, as well as heightening the felony charges for possessing 1 to 4 grams of fentanyl. And so now the question, and what a lot of people are watching for, is how that's going to actually play out in the state.
Yeah, we've talked a lot about the enforcement from the fentanyl bill, but not the treatment side. So is there a report required or anything that tells us that treatment is lacking?
Yeah, and here's the thing is that Dr. Valuck says that he thinks this is really going to highlight that gap that we're already seeing in Colorado. What he is worried about is, will people be able to get the help that they need before getting in trouble with law enforcement? What about afterwards? And one of the things that the law will be doing is it's requiring all jails to provide medication-assisted treatment. Now, before it was optional, so a couple of jails, a lot of them actually were doing it, but we didn't see it universally in the state, and that is supposed to be changing.
Will it reveal anything else about the crisis compared to other states?
Yeah, and I mean, I think at this point, you know, Colorado is doing a little bit better, but, you know, one of the things that Dr. Valuck said is he's really hoping for this balanced approach. You know, you see the state, part of that law, focusing on the criminal side. He said it's important to go after the cartels and big players, but at the same time, you know, what you hear from him and so many of the people on the grounds, you keep hearing about treatment and lack of resources, and how are we going to address that?
This is the problem with, I feel like it was a 70-some-odd page bill. Maybe I'm misremembering which bill.
It was long.
This is the problem. We focus so much on one little bit, then there's all these things that we haven't talked about
All these
yet.
other little elements.
Thank you, Anusha.